specifically to the BRCA BRCA test, BRCA1 and 2 genetic mutations, or the hereditary breast and ovarian cancer panels that we do for genetic testing. These are not recommended for general population screening. So it's not like, okay, my annual health check, I do a hemogram or a blood sugar level, I'm going to include a BRCA test. That's not what is recommended, because the incidence population wide, I mean, we say, yeah, 5 to 10% of all breast cancers, but population wide, if you started screening people, the incidence is actually less than 1% of your likelihood of finding a BRCA mutation. And even in patients who meet criteria for testing, so as oncologists, we offer testing to our breast cancer patients who meet certain criteria for testing. And now we can talk about what those criteria are later. But specifically breast cancer patients or family members who have a high-risk history where, you have multiple family members on one side of the family, either on your father or mother, biological parent side, who have had breast, ovarian, pancreatic, prostate cancers on one side of the family, especially young cancers, multiple cancers in the same individual. And there are certain specific criteria that an organization called NCCN recommends we use for testing. Now, that being said, these criteria are used mainly to select out patients for testing where there is a third-party payer system to justify testing. But now what we've realized is, especially when it comes to breast cancer patients, we were using these criteria selectively, and now we become more liberal about the use. Because if a certain patient says that, even if my probability of having this gene mutation is 2-3%, and I want to know, can I do the test? And they're paying for it, and they're willing to undergo the counseling. So no test should be done without pre-test genetic counseling, because these tests are complex, the results are difficult to interpret, and it's not appropriate to do a test unless you know how you're going to utilize that information. So to bring to about your point of whether it's simply curiosity and anxiety provoking, that's no longer true, because now you have methods of mitigating risk in a gene mutation carrier. That being said, it's still a very, the solutions that oncologists have today, whether it is a preventive mastectomy, which it's a more acceptable solution today because we have advanced methods of breast reconstruction. So it's more or less like undergoing a breast replacement surgery so that your genetically inherited breast tissue that is there in your body, which is mutated, let's get rid of some of it so that your risk of developing breast cancer, whatever it is, that 60% risk is reduced by 90% of what that was. So not gone to zero, but still you're achieving a significant risk reduction to where now your risk is almost the risk of an average woman when it comes to breast cancer. And of course, these women also recommended to undergo removal of the ovaries and fallopian tubes because they're at high risk of developing ovarian cancer as well. But every genetic test needs to be accompanied by a very thorough genetic counseling appointment. And that's an interview where, we evaluate the patient's family history, we study the pathology reports in the family, advise who's the right family member to be tested first, and then suggest, well, how are you actually going to utilize this genetic information to mitigate your own risk if you were in fact a carrier.